Derivatives of the endoderm. Three main derivatives of endoderm are gut tube, respiratory tube, lower part of the genitourinary tube. Gut tube is divided into three parts: foregut, midgut, hindgut. In the terminal hindgut, we have the cloacal region where there is development of urorectal septum. The urorectal septum divides the terminal hindgut into two parts: urogenital sinus anteriorly, rectum and anal canal posteriorly. Urogenital sinus contributes to the formation of urinary bladder, urethra, lower part of vagina. Therefore, their epithelium is endodermal in origin. Allantois or allantoic duct is an endodermal hindgut diverticulum which comes from the apical part of urogenital sinus. Allantois becomes a content of the umbilical cord. Vitellointestinal duct is an endodermal midgut diverticulum which also becomes a content of umbilical cord. Important information: the allantoic duct and vitelline duct must get obliterated in the normal course of development. In the foregut region, there is a tracheo-esophageal septum. The tracheo-esophageal septum separates trachea anteriorly, esophagus posteriorly. The tracheal diverticulum in the foregut gives rise to trachea, bronchus, lungs. Pharynx is a foregut derivative. Lateral wall of pharynx gives rise to a few pharyngeal pouches. The endoderm of these three pharyngeal pouches forms the epithelium of parenchyma of thymus and parathyroid gland. Liver and pancreas develop at the junction of foregut and midgut, mostly derived from the foregut and partly from the midgut. Endodermal in origin. Extraembryonic structures contribute to the formation of placental membranes, chorion and amnion. Placenta is formed by trophoblast and extraembryonic membrane. Extraembryonic mesoderm is derived from the cells of lining the primary yolk sac, also known as primary umbilical vesicle. Amniotic cavity, primary yolk sac, trophoblast, epiblast, hypoblast, Husser's membrane, extraembryonic mesoderm, primary mesoderm. Connecting stalk. All these will be discussed in the matter below. Important information. First, we will know about important information. The origins of extraembryonic mesoderm is a controversial question. Some authors say that the origin is from hypoblast, some say it is from epiblast, some say it is from trophoblast. However, best answer for the origin of extraembryonic mesoderm is the cell lining primary yolk sac. There is development of another cavity in extraembryonic mesoderm. This is called extraembryonic coelomic cavity. The extraembryonic coelomic cavity divides the extraembryonic mesoderm into two parts: visceral splanchnic extraembryonic mesoderm towards the yolk sac, parietal or somatopleuric extraembryonic mesoderm towards the periphery. Splanchnopluric extraembryonic mesoderm only lines the yolk sac, which is now called secondary yolk sac. Somatopleuric extraembryonic mesoderm lies outside the extraembryonic coelom, forms the chorion, forms the amnion. Placental membranes are chorion towards the exterior, amnion towards the interior, lining the amniotic cavity. Chorion is formed by trophoblast, somatopleuric layer of extraembryonic mesoderm. Amnion is formed by amniogenic layer, somatopleuric layer of extraembryonic mesoderm. Connecting stalk. Latter forms the primary umbilical cord. Important information. Splanchnopluric layer of extraembryonic mesoderm does not contribute to the formation of chorion or amnion. Somatopleuric layer of extraembryonic mesoderm contributes to both chorion and amnion.